My name is Kim. I'll be one of your nurses today. Can you tell me your first and last name, age, and date of birth?
Yes, my name is Sarah Smith. I'm 35 years old, and my birthday is 9/24/1982.
Hi Sarah, I'm Victoria. I'll be your other nurse today. I see you have been diagnosed with Legionnaire's disease. Did the doctor explain what this disease is?
Yeah, he did, but I'm still a bit confused about how I caught this. Can I get an explanation?
Sure. The cruise you have recently taken had reports of Legionella bacteria containing the water supply, which causes the Legionnaire's disease.
The Legionella bacteria is what is causing your high fever, greenish-colored sputum, having chest pain when you breathe, your pulse oximeter of 89. You may also be experiencing tiredness, muscle aches, and loss of appetite.
Yes, I'm really not feeling well. I feel weak, my head hurts, and I haven't been able to stop coughing for about 3 days. I'm also feeling a little anxious and scared.
I understand this could be a very scary thing to go through. Your doctor has prescribed some antibiotics for you that should help improve your symptoms within the next week.
You've been prescribed with 2 antibiotics called Azithromycin and Minocycline. Antibiotics are drugs used to treat infections caused by bacteria, like the Legionella bacteria you have. Have you heard of either of these medications before?
I have heard of azithromycin. My sister took it for strep throat. She said it made her feel better, but it helped her feel better within 3 days. But I have not heard of minocycline.
Yeah, each antibiotic only works against infections caused by certain types of bacteria. So there are many classes and types, and they treat many different types of infection. Azithromycin is a macroslide antibiotic, which are typically used to treat infections such as strep throat, like your sister had, along with syphilis, Lyme disease, and respiratory infections. They're also used to treat more severe infections such as pneumonia.
Minocycline is very similar to azithromycin as it is used to treat and stop the growth of bacteria. It is part of the penicillin family and is used to treat infections as well.
My sister was prescribed azithromycin tablets about once a day. Is that the dose I'm being prescribed?
The dosage of a drug depends on your age, the condition being treated, how severe your condition is, other medical conditions you may have, and how you react to the first dose. In your case, the doctor has prescribed azithromycin in an IV as a single dose on day 1, followed by 1 tablet taken orally on days 2 through 5.
The IV dose for your first day will give us a better understanding on how your body reacts to the medication. It will also prepare your body for the critical concentration needed for the drug to work at the best of its ability. For the minocycline, you will be taking 2 tablets orally on the first day, followed by 1 tablet orally for the next 5 days.
I take medications for my seizure disorder, atrial fibrillations, and warfarin as anticoagulant to prevent blood clots. They cause some side effects. Will these antibiotics cause any?
There are some common side effects for both, which include diarrhea, nausea, stomach pain, and vomiting. These effects are mild. They may go away within a few days or a couple of weeks. Minocycline may also cause lightheadedness and dizziness. If they are more severe and don't go away, don't hesitate to contact your doctor.
Some serious side effects may include hives, trouble breathing, blistering of the skin, and severe diarrhea. Also, since you have a history of abnormal heart rhythms, taking this drug can increase your risk of having an arrhythmia that may be fatal. You are also taking warfarin as an anticoagulant. The interaction with both antibiotics may cause excessive bleeding.
But we are giving your first dose in an IV form in the hospital, so we will monitor you closely and determine if the drugs are safe for you to take. Also, minocycline can make birth control pills less effective.
I've been taking Tylenol for my fever and aches, Xanax for my anxiety, and I'll use alternate forms of birth control for the next week. Are there any over-the-counter medications okay to keep taking?
Yeah, both Tylenol and Xanax are safe to take with both antibiotics. Do you understand how they should be stored and when they should be taken?
After my IV dose of azithromycin, it should be stored at room temperature. I'm not supposed to store them in moist or damp areas, so I can't keep them in my bathroom. I can take both oral tablets with or without food, and I'm not supposed to chew or crush the tablets. They should also be swallowed whole, and I should drink a full cup of water while taking them.
Great understanding. If you experience stomach pain or gastrointestinal irritation, try taking the medication with some food. Since these are broad-spectrum antibiotics, they are very strong and may cause fungal infections such as a yeast infection. You can take a probiotic with the tablets. They come in pill or yogurt form to help reduce the risk.
Now make sure you follow the doctor's orders for taking the tablet only once a day and do not crush them. You shouldn't need a new prescription for this medication to be refilled. Your doctor will write the number of refills authorized on your prescription. Since you need to be monitored, we will check back when you have finished and see if your infection is getting any better.
Yes, the doctor explained if I take too much, I could have dangerous levels of the drug in my body. This may cause liver damage and irregular heart rhythm, which I definitely don't want. What happens if I forget a dose?
Take the missed dose as soon as you remember and skip the missed dose if it's too close to the time scheduled for your next dose. Do not take extra medication to make up for the missed dose.
Skipping doses may also increase your risk of further infection that is resistant to antibiotics. Throw away any minocycline not used before the expiration date on the medication label. Using expired minocycline can cause damage to your kidneys. As long as you follow all the directions of the antibiotics, you'll feel better within a few days.
Thank you so much for all of this information. I understand everything and you were very clear.
We hope you feel better.
Feel better.
Thank you.